this afternoon. I am Jill Mays. I'm the Division Director for Crisis Systems Transformation in the 988 and Behavioral Health Crisis Coordinating Office at SAMHSA. And so I'm always excited to share about 988 and the crisis continuum because we want people to be aware of the services that are available in their communities so that people can get help to stop hurting and help to move on to being their best well selves. And so I thought it fitting because this is the Pastoral Care Conference, and in the other half of my life, I am an elder in the Baptist Church, and so faith is a huge part of what I do. We at SAMHSA have many faith-based initiatives that we do because we believe that people will seek help at their churches or with their faith leaders before they will go to see a professional counselor. And so when we think about the crisis workforce, we know that faith-based leaders are very important partners in this work with us. And so a scripture came to me, Isaiah 41:10. It says, "Fear not, for I am with you. Be not dismayed, for I am your God. I will strengthen you. Yes, I will help you. I will uphold you with my righteous right hand." And when I think about my own lived experience as a person who's been through major depression, suicidal thoughts, I know that it was my faith that eventually got me to have the courage to seek professional help, and is the reason that I'm standing here before you today. So I know the power of spirituality when folks are in crisis, and so I know it helped get me to where I am today, and I know for many other people that their spirituality or their faith is an important part. So I thought that was a good place to start to kind of center us and ground us for today's discussion. And I want this to be a discussion. I have a lot of information that I'm going to give you here, but feel free as I go through. If you have questions, you don't have to wait until the end. You can just stop me right there and ask, and we can just have that dialogue. So I wanted to talk to you about who SAMHSA is. And SAMHSA, as I said, is the Substance Abuse and Mental Health Services Administration, and it's the agency within the U.S. Department of Health and Human Services that leads the public health efforts to advance the behavioral health. And behavioral health includes mental health and substance use disorder. So to advance the behavioral health of the nation and to improve the lives of individuals living with mental and substance use disorders and their families. And I know that is part of you all's vision as well. SAMHSA's mission is to lead public health and service delivery efforts that promote mental health, prevent substance misuse, and provide treatments and supports to foster recovery while ensuring equitable access and better outcomes. And remember that we're going to come back to that equity piece in our role in helping to ensure that communities that have been underserved in the past actually get the services that they deserve and have a right to have. And SAMHSA's vision, we envision that people with, affected by, and that includes family members and friends, or at risk for mental health and substance use conditions receive care, thrive, not just survive, thrive, and achieve well-being. So that's SAMHSA's mission and vision. And to achieve this mission and vision, SAMHSA has identified 5 key priority areas to help better frame all of our efforts in addressing the behavioral health care needs of individuals, communities, and families. And a piece of that framework is equity. And then trauma-informed care is another thing that kind of encompasses the 5 areas of work we do. And if you think about just the African American community, how much trauma many of our family members and friends have experienced, whether it's abuse in the home or just racial trauma that impacts us and is kind of a part of our day-to-day existence. Sometimes we come to the place where we don't really think about that kind of trauma, but it's there and it impacts us. And in times of crisis, the impact may even be a little more heavy for people to deal with the crisis at hand, as well as all of the traumatic things that weigh on the ways that they deal with things, their resiliency level, their coping skills. So it's important that we look at equity, trauma-informed approaches, recovery. At SAMHSA, we believe that everybody can recover, no matter what mental condition, mental health condition, or substance use condition. Everybody has the capacity with the right support to get to, again, that place of thriving, not just surviving, but getting back to a place where they feel good about the life that they live every day. They feel good about contributing to the communities and the families that they are a part of. So recovery is a really big principle at SAMHSA, and the value of lived experience, the value of peer support. And if you think about things that you've been through, me and Ms. Pickens were talking earlier about medical conditions, that somehow at times, if you've been through a medical condition, a person who you can really relate to is somebody else who's been through that same thing and is, has come out on the other side of that. And so the power of peer support, individuals who are in recovery from mental health conditions or substance use disorders, and can say to that person, I've been where you are. I know kind of what you're going through, what that feels like, and they can offer their experience and their strength and their hope to say, if I could do it, you can do it too. So the power of peer support. The power of data and evidence. There's kind of a phrase, if there's no data to support it, it didn't happen. Data is what you use to analyze, the effectiveness of the programs that you put forward. Data is how you determine whether the financial resources are being spent well. So data and evidence are very, very important at SAMHSA. We don't want to, we have to be good stewards, the citizens of your money. So we use data and evidence to make sure that the programs that we're funding are reaching the intended audiences and having the intended outcomes. So that's kind of how we frame up the mission and vision. And the 988 office, our goal, we're serving as the lead organization to advance the 988 continuum. And I'll tell you a little bit more in a minute about what the 988 crisis continuum is. But the Behavioral Health and Crisis Coordinating Office, we're kind of tasked with leading that work, which is managing the network administrator. That's the agency that actually runs the 988 Suicide Lifeline, but also managing grants to all of the states and the territories and the tribes in the country to help advance that work as well, to set up their call centers and also to set up the rest of the system that we'll talk a little bit more about. So SAMHSA provides grant funding to help states do that as well. And all of that, the work that we do was made possible by the Consolidated Appropriations Act that was passed in December of 2022, and that is what funds the work that we do in helping to spread the ideas, the concepts, the standards, the guidelines of the continuum across the country. So, behavioral health continuum. If you'll think of the behavioral health continuum, it's the way crisis services fit into a person's life, and it's kind of a roadmap. So you start with prevention, and that's where we want to put a lot of emphasis on. If we can prevent, people having severe mental illness, if we can prevent the problems related to early substance use and substance misuse, that's where we want to put a lot of focus, because the system where the treatment happens, we don't have unlimited resources. None of us, if you have a budget at your house, we don't have unlimited resources. So the fewer people that have to go into the crisis system, the better. So we want to focus a lot on programs in elementary schools, middle schools, high schools, to help kids at a really, really early age build their resiliency skills, learn coping skills, so that when they get older and they come upon problems, they already kind of have some things in their tool belt to help them deal with it and to manage those really strong, powerful emotions so that they don't maybe advance into crisis. So we've got the prevention, and then in the middle, you have the actual treatment services, crisis treatment, and then Once a person is stabilized from a crisis, then they go into outpatient treatment where they're followed by counseling professionals until they get, again, to that place of thriving. And then after when they're in the kind of phase of recovery, then, some may choose, again, as peer providers, to give back to others who are coming along that journey. And some just, go on and say, I just want to live my best life, live my life like it's golden. That's one of my favorite songs. And so, but then there's follow-up care, which is important as well. And follow-up is important because when people move from one place to the next, it's easy for balls to drop and for people to fall through the cracks. So that follow-up provides for the seamless and smooth transition. For example, if someone calls 988 and it's determined that they want and need services in the community, the 988 counselor, they can't actually be there with the person, but they can send a mobile crisis unit. But you have to make sure, you follow up to make sure that the mobile crisis unit had the information that they needed to get to the person, that they actually got to the person. And then when mobile crisis is on the scene, they provide their service, which may involve referring the person to a stabilization unit. But somebody's got to make sure that the person gets there, helping to arrange transportation. And if transportation is not provided by the mobile crisis team, following up to make sure that the person actually got to the facility. And then once the person is stabilized and they go home, but their discharge plan is you will connect with a provider in your community. Somebody needs to call to say, did you, we set that appointment, did you make that appointment? And that's how the follow-up piece is how we make sure that people transition smoothly to the system and nobody falls through the cracks. But we'll come back and talk a little bit more. Yes, ma'am.
What I heard two words in this piece right here, that you're proactive before you become reactive.
Absolutely. I couldn't have said it better myself. Proactive before you have to come reactive. But for when we're not able to prevent, our hope is that the system is prepared enough that the system, we're reactive, but we have a planned and well thought out and strategic response to the individuals who come to us in crisis. So it's not we're reacting to, but it's more a coordinated response. So we've thought about it. I don't know how many of you watched Sesame Street as a child, but one of my favorite songs on there was If I Knew You Were Coming, I'd Have Baked a Cake. And so that's kind of how I think about crisis services, is when a person presents for crisis services, they ought to feel like somebody knew that one day I might need this service. And they thought about me specifically and what I might need, and they have that here. So it's important that people feel like their needs were anticipated and that, we've done all that we can to make sure that those supports and services are in place for you. So what is a behavioral health crisis? Anybody want to take a stab at that?
A meltdown.
A meltdown?
You got it right, Joe.
Okay. So a behavioral health crisis, and we try to move away from saying to people that they're having a meltdown, because that's one of those things. You're shaking your head. I know you already know where I'm going. That sometimes that keeps people from seeking help because they're thinking, especially a lot in our community. Anybody in here grow up with the what happens in this house stays in this house? And so it's hard sometimes to have the courage to seek help. And so one of the other things that we do is we talk a lot about language and what language can we all use that helps people to feel safer in getting help and to understand that they won't be ostracized for trying to take care of themselves. And so, yeah, we're not gonna say they had a meltdown. See, we already know. We already know the words to say. Exactly. So a behavioral health crisis is any event or situation associated with a real or a potential disruption of stability and safety as a result of, as you all said, mental health or substance use issues or conditions. It might begin at the very moment when things start to fall apart. Say, for example, a person has been stabilized on mental health medication and they run out of their mental health medication. So for that person, and they can't get it because they don't have the money to get it. That can be the point where things begin to fall apart. Or it might be just a continuous buildup of things that end up with the person feeling like they're not stable anymore and that they need to get connected back to the supports or to find the supports that they need to move forward. So requests, when someone is having a behavioral health crisis, they can request help themselves, but a lot of times people in crisis aren't really able to do that for themselves. So someone, a caregiver, perhaps if it's an older adult, I was sharing my dad's 92, and so we do a lot of things for my dad now that he used to do for himself. So sometimes a caregiver may be the person to reach out to say, you know, this person that I care about or love or I'm taking care of seems to be having some type of crisis and needs help. Or any concerned person, a teacher at a school, a counselor at a school, a minister at a church, a pastoral care counselor, anybody who recognizes that a person may be in distress can initiate getting them some services. So a crisis is more than just a single discrete event. It's not just the one thing. Say if a person is having suicidal thoughts and they are able to talk to a counselor and they begin to feel better, a little less distressed, a little more stabilized. Because they feel better in that moment, does that mean that the crisis is over?
They tend to be well at masking.
Yes. And so we have to recognize, great that you feel better in this moment, but now we can talk about now what happened that got us to this moment and what can we do to prevent that from happening again. And so that person, the crisis continues until a person is stabilized. And sometimes you can feel better in the midst of the crisis. But again, it's not just that acute thing that you might see or the person might express. It's all of the things that go along with that, and they have to go until they're stabilized, and then the crisis is over. Yes.
Yeah, as a hospice chaplain,
Mm-hmm.
I have a patient who, the daughter is experiencing caregiver burnout.
That's a real thing.
I mean, she experiencing caregiver burnout. She's stressful, and she's at a wit's end limit. However, she won't accept any suggestions or help as far as placing her mother, even daycare. She won't separate from her mother. So my question is, I think I'm taking on that anxiety.
From her.
Yeah. Versus, cause when I leave there, I feel like it's my issue. Is that common?
That's very common, and maybe part of the reason that she's having a tough time letting others help her mom. If you think back, for traditionally, for African Americans, you didn't place people outside of the homes. Somebody made that sacrifice and took care of that person, until that person passed away.
She don't think anyone would treat her mother like she did.
Mm-hmm.
And I go to the point, because I go to another place, not far from our house, and I told her, I said, it's like 2 blocks from your house. And they have a assisted living in that home. And I asked them, because I went to that home and asked them if they would consider taking on in the daytime. They couldn't do that. They have to take her in as a living.
Right.
Yeah, so I'm thinking.
But she has to maybe there's some guilt that she's dealing with around having somebody else to come in and take care of her mom, and kind of her identity as a good daughter. You know, what will it mean if I'm not able to take care of my mom by myself? My mom took care of me when I was growing up, and I should be able to do that for my mom, right?
But I'm
But-
more concerned right now about me taking it on. Yeah, but I feel like I've taken the burden, not from her or off her, but just myself.
There's something that happened in your life that you never dealt with, which is triggering that reaction. And
It
you
could
gotta
be
figure-
triggering, it could be triggering
And,
emotion.
and you gotta find out what that is, so you don't feel as if it's your issue.
But I mean, it frustrates me, you know.
That's the trigger,
for
that's
me
the
to
box.
go-
And so one of the things that you'll leave here today with is a tool that you can give to her. If she's not at the place where she's ready to do anything different, except maybe she would call 988 when she's feeling overwhelmed and distressed, and the counselor there can give her some support, and then maybe help her to decide on resources for herself, because maybe the right choice for her isn't putting her mom in a facility. Maybe the choice is her just learning how to take care of herself better, and to kind of analyze what natural supports she has around her that she would feel comfortable with. But the first part is her being able to take care of herself. So when you leave here, you'll be able to say, you know, there's this number that you can call where you can get some support when you feel overwhelmed, and then she doesn't have to call you all the time.
Right.
But you could call 988 also if you're feeling overwhelmed and distressed, and to just talk through and get to a solution for yourself. Because as caregivers, you know, a lot of times we're the last person to get help for ourselves. And you know, on an airplane where they tell you that, you know, you're supposed to put your own mask on first, and they tell you that because, you know, if you're passed out on the plane, who can you help on the plane? And such is the same in life. If we don't take good care of ourselves, how can we continue to do this work that we're called to
But
do?
as children, we're not taught to take care of our parents when they become adults. There's something we just kind of reverse the roles. What does that role entail? And I know when I started taking care of my dad, I took it as an opportunity to be you know, be honest. He had to depend on me. Now I ain't got to listen to your mouth, you got to listen to mine. I'm being honest.
Yeah.
And in dealing with him, I learned a lot about myself, but I also learned just give him a little room to breathe.
Yeah.
You know, don't be afraid to say, Uncle Boy, come sit with your dad while you're with your brother while I go for a walk. But it took me a while. It took me getting angry. You know,
Yes,
I ain't saying I ain't never put my hands on him, but I got angry.
yes.
You know, because as my parent, he still wanted to correct me.
Right.
But I'm cooking your breakfast, lunch, dinner, washing your clothes, and I'm doing things I didn't have to do after I left your house. So I'm hearing you, but I'm on the other side, and I hear this daughter, she's doing what she feels. No one's told her she had to.
Well,
And
yes,
she put that weight on herself.
no, her siblings won't help her.
Well, it's always one.
Yeah,
My
always-
four siblings
that's right.
don't call me, but it was just me.
And
Right.
and all of this that we're talking about, it kind of goes back to what I was saying earlier, is that the more people that we can get connected in times of distress to those community services that are available, where you can have these conversations and talk about, why is it that I feel the way that I feel? Why is it that I'm doing what I'm doing? And how do I deal with siblings who, you know, aren't willing to provide the same level of support? How is it that I deal, what do I do with these feelings that I have that, you know, I'm resentful now that, you know, my parent, as you said, needs my help, but they're making it hard for me to help them. But talking to a professional counselor or a peer in the community, a lot of times is all that's needed, but we haven't been, well, exactly, we haven't been educated that those services are out there, and we haven't been given the freedom, minus the stigma, to know that it's okay to not be okay. You know, being in that generation, you know, where you're caring for parents and some are still caring for their own children, that sandwich generation, that's a tough place to me. But a lot of people don't feel like they can talk about that. And so part of, our raising awareness about this crisis continuum is to let people know that in times of distress, no longer do you just have to sit there and suffer.
And it's okay to walk away.
But
You gotta set your boundaries.
another thing underneath that, or probably right beside it, is the fear of failure.
It's what?
Does your agency monitor the respite care?
So, huh?
We don't monitor respite care, but there are state agencies that do, and there are guidelines and there are standards
Oh,
that
she
those
won't
facilities
do that.
are supposed to follow. All right. So the need for 988. Why do we need a 3-digit number that people can call? There was the suicide hotline is not a new thing. There's been suicide hotline for years, but it was a longer, it was a 1-800 number, and that's hard to remember. But if you have a medical emergency or your house catches on fire, do you have to think about what number to call? What number do you call?
911.
911.
Now we
And
got 311.
so we have all the 111s. But now we have 988, which is an easy number for people to call, so that when there's a behavioral health crisis, one, you don't have to call 911 anymore, because if you're having a behavioral health crisis, is the fire department really the best equipped
Or the police.
for your needs? Is law
They're
enforcement
trained,
really the best equipped to? That's a good point that you made, that they're trained now. And yes, there's some wonderful crisis intervention training and other trainings that are helping law enforcement to become more aware. But now I could be a volunteer firefighter, but I'm not gonna be your best bet. I can help, but I'm not gonna be your best bet. And so everybody, law enforcement, all the first responders, they're an important part of this continuum, but it works best when everybody does what they're best at. And so that is how we encourage states to work with their law enforcement. There are times when there are emergencies and imminent, if a person is at imminent risk of suicide, where law enforcement is the appropriate place to go in, because they need to make sure that everybody is safe. But we also have to make sure that there are those stabilization facilities in place that law enforcement can transport people to, and then they can get the care that they
The
need.
officer that's answering doesn't agitate the situation.
So all of that, we all have to work together to educate ourselves and become aware and understand, how do we fit these pieces of the puzzle together the best, and we really can't leave anybody out. So we need 988 because there's one death by suicide every 11 minutes. And we've been here for, I think I've been here about an hour or so. You think how many people, have died, a death that could have been prevented in our country. So there's a death by suicide every 11 minutes. And in 2023, over 100,000 people died from drug overdoses.
Wow.
And those are preventable. So there's a need for this crisis continuum that we can all focus on and figure out where we fit and how we promote it and educate people about it. So the Lifeline Continuum, I told you I'd tell you what it is, and it's easy to remember. It's someone to talk to, someone to respond, and a safe place for help. And so that someone to talk to, that's 988. You call, there's a trained counselor on the other end of the phone who's there waiting to assist to work through the crisis. And if it's determined that maybe the phone call is not enough, maybe we need an in-person response, then there's mobile crisis units where trained counselors or peer specialists can go to wherever the person is, at their home, at the library, at the gas station, at the daycare center, at the school, wherever the person is, the mobile crisis team can respond and then assess the situation while they're on the scene and then figure out what the next appropriate best step is. And then sometimes it's determined that a person may need a stabilization facility. Maybe what they're dealing with doesn't really lend itself well to, well, we'll help you to make an appointment with the local clinic tomorrow or the next day. They need help right in this moment. So that's a safe place for help. And these are the stabilization units that are safe places for help, that are appropriately staffed with skilled staff, and everyone has the understanding that this is person-centered. It's about that person and their unique needs, and that's all we're here for, is to help that person work through their crisis and provide them the medical, psychological, social, all of the things that they would need to become stabilized. So it's real simple. That's the whole continuum. Someone to call, someone to respond, a safe place for help, and then we'll add, because I said it was important, the follow-up to make sure that people move seamlessly through the system. So, before I started talking today, how many of you were familiar with 988? Okay, we got one person, so I'm gonna ask y'all that again at the end. And everybody should raise their hand and say, I know all about it, and I can tell everybody that I meet all about it. So
911 don't work no more.
you can still call 911, but we're talking about what's the best way to get a person with behavioral health distress and crisis. How do you get them connected to the fastest to a behavioral health professional? Yes, again, law enforcement is important, but law enforcement isn't always needed in a behavioral health crisis. And there's someone sitting in the back, sometimes that might not go well. We've all seen instances in the news where it didn't quite, the outcome wasn't what we would have wanted it to be. So again, it's thinking, what's the best thing? To call to get help, that's the first thing. But then you have to think, well, what's the best number to call for what's going on right now? And
Will that number, 988, is that gonna take away the 1-800-872-4200?
the old line will always be there for people who kind of have that locked into their mind. They will always still be able to call that number. But we want everybody to know that it's easier. Just dial 988.
Good. Crisis and stabilization.
Yes. So I was going to show you all a video,
Yeah, right.
but we don't have the screen, so we can't show that. Maybe I'll send that to you all. It was just a real good summary video of 988 and how the crisis continuum works. And we have some really great partners who helped us with that video. SAMHSA has wonderful partners who are passionate about this, and in this video it has a couple of NFL players who have had their own experiences with suicidal thoughts or suicide attempts, or have had family members who've had suicidal thoughts or who have died by suicide, and they're very committed to wanting people to understand that 988 is available. There is help, and no one has to be alone. One of the players wore 988, I think, on his cleats in the Super Bowl. It's not coming to me right this second what his name is. He's on my fantasy football team, which is funny in itself because I don't even like football, but I love my kids and my husband, and they like fantasy football, so I have a fantasy football team. It'll come to me in a minute. I think it's Dak Prescott.
Dak Prescott.
Yeah, I think that's his name. He wore 988 on his cleats. But there are lots of celebrities and influencers whose families have been impacted by suicide, and so they're happy to support and spread the word and use their influence and their platform to let everybody know about this life-saving 988. And now you all, after today, y'all are going to be influencers too, to be able to go out and tell everybody that you know. So again, I'm going to review again what the full crisis response continuum is. It's outreach and engagement to people who are at risk for crisis. That's the prevention that I talked about before. I think you were telling me over lunch that you all were talking earlier about mentoring youth. And those types of programs are so important that we catch youth at a young age and teach them the skills to be able, again, to problem solve, for conflict resolution, how to manage those really big emotions. So that kind of outreach before the crisis is very important. Then we have the Crisis Call Center, the 988 Center. And 988, you can call 988, but you can also text 988. There are counselors who can help you and support you over text. And for a lot of young people today, they don't talk on the phone. They like to text. And so this has made it easier for them to be able to get connected. But you can also chat with a 988 counselor. There's a web page that I'll give you in a little bit where you could go on there and you can do a chat. If you like to type your stuff, you could do a chat. We try to think of all of the ways to make 988 accessible to everybody who may need it. So you've got the outreach, the prevention piece, then you've got the actual place to call. Then next you have the mobile crisis teams in case of face-to-face response is needed. And then if someone needs a higher level of care than that, there's the crisis stabilization units, and then there's the post-crisis community follow-up. And again, talking to faith-based communities, sometimes all the follow-up a person will need after they've been through the crisis, they've been stabilized, is they need community. You know, we all need other people who see us, who interact with us, who let us know that they care about us, who help us to reach for our dreams. And sometimes your church, your faith community is exactly where you can find that kind of support. So faith communities can play a super critical role in helping people, once they're stabilized, to stay stabilized, or at least to know people who care about them that they can reach out to, who can help them manage if another crisis comes along. So you guys are important.
Jill,
Yes, ma'am.
I'm moving with you, which train of thought.
Mhm.
My concern and our concern is that the faith community hasn't really been trained.
Mhm.
Right? So that's another issue. I don't mean to get you off track, but that's.
You saw my slides, didn't you? So I was going to talk to you all at SAMHSA. We are working on several faith-based initiatives, and many of the offices across SAMHSA, not just the 988 office, have faith-based initiatives.
I
That
just finished the 3-month one at Springfield. So the churches are doing, Bishop Jackson is really pushing, you just didn't get a lot of people signing up. We say we wanna know, but then we gotta sign up.
So I was also sharing earlier that there are grant programs that will support churches doing the work to develop counseling ministries within their churches, to bring in mental health first aid trainers who will help everybody in your congregation learn how to recognize the signs and symptoms of mental illness, and to know how to connect a person to those services, how to have that conversation. Because it's not always an easy conversation to have, because again, we grew up, don't talk about it.
Even how to embrace them in service.
Yes.
If you're having what do we call it? If they're having an episode, you don't, oh my God, look at him. You know,
Again,
you
help,
need to understand what that is.
helping to decrease
The
that
first thing you
stigma.
do is give them space. You don't bombard. You know, those are the trainings that we got.
So those are the things that SAMHSA is really, we're prioritizing, helping faith-based communities to learn how you can be an extension of the workforce. And all it takes is training to know how to do that, how to have those conversations. So that's a real big part of our effort. We just, on September the 8th, we had 988 Day. It was the first annual 988 Day where we did a webinar for faith communities, and we call that Faith in Action Weekend, where we made suggestions of things that congregations could do to raise awareness around 988, like having a speaker to come to your service, you know, that weekend, who could share their experiences of going through having their own suicidal crisis, or having lost someone to suicide and what that was like. So doing, or playing a video that with their, the White House Office of Community and Neighborhood Partnerships has made several videos that congregations can show in their church on Sunday morning. They're short enough that they're not going to take up the whole service time, but they're chock full of information. One that brings that stigma right down, that stigma that says, you know, all you need is prayer and to read your Bible more. And, you know, these are videos that really help people to understand that, yes, those spiritual principles, those are important. Those can get you through. But it's okay to, you know, pray and go to therapy as well. I'm a living witness that you can pray and you can go to therapy, and God can use all of that stuff together to help you to get to the place again where you're thriving and living the life that you were put here on this planet to live. So we are focused on the faith-based initiatives in training as many faith communities as are willing to help us in this continuum. So what happens when you call 988? That's a question. People, sometimes are afraid to call because I don't know what they're going to ask me when I call. Are they going to be trying to get all in my business? So what happens when you call 988? So first thing, you call 988, a recording comes on that gives you options. Because even within 988, we have some specialized sub-services as well. If you press 1, that will get you to the Veterans Crisis Line. Do we have any veterans? Thank you for your service, sir. But there's a line that veterans can call, and the trained counselors that answer that phone, not only are they trained in the mental health piece, but they're also trained in military culture to understand the differences and the unique things that a veteran may bring to that call, because they've had experiences that most of us as civilians can't even imagine. But they've had special training to be able to relate to what a veteran might share and to be able to connect to that military ethos.
Awesome therapy.
Exactly. So there's press 1 to get to the VCL. For those, everybody here, English is not their first language. So a lot of people speak Spanish. So we've got, if you press 2, you can get connected to the Spanish line where the counselors, not only are they trained, but they also speak Spanish. Because if you're in a crisis and you're having to translate or kind of translate to somebody, you're not getting the help that you need because that language is a barrier. So we have a Spanish line. But Spanish is not the only other language. The counselors also have access to a language line. And that, if you tell them the language that you speak, they can get someone that speaks that language to come and assist with the call. Then we have press 3, which is our line for the LGBTQ youth. If you look at suicide statistics, the suicide rate among youth in the LGBTQ community is extremely high. And again, they have a lot of unique issues. There's the mental health stigma, but then there's also the stigma around their LGBTQ status. And so there's a special line that they can press 3 and they can get to a counselor who has that advanced training and lived experience and peer support can be a part of that as well. But if you don't want to listen to that whole recording, you don't have to. You can just press 0 and you can get connected to a counselor right away. So that's what happens initially. And then once the counselor answers, they will basically ask, what is your crisis? How can we support you today? And then based on what the person says, they'll kind of go through a series of questions and offering support and offering suggestions, but really just listening for what the person wants and what the person needs. Again, even the calls are very person-centered. It's about what the person, and we were talking about what a behavioral health crisis is before, but a person defines what a crisis is. What may be a crisis for you might not be a crisis for me, and vice versa. So it's very important that the person gets to decide, I'm at the place where I'm feeling overwhelmed with what's going on in my life, and I'm reaching out for help. So you're not limited to, you can only call if you have a serious mental illness, you can only call if you're suicidal. You call whatever you define as a crisis, the 988 counselors are there to help. So when you have your press 3 options, you have the press 0 option to get directly connected to a counselor, and then the counselor will support you in ways that you all decide together are best. Yes?
Are there any age limitations?
Age limitations? No, but counselors have to be specially trained to work with children and youth. So there are things around that, and counselors go through a whole battery of training because there's so many different types of callers that they might encounter or situations, and so they do get training on how you talk to a youth. There's training on what to do if a report needs to be made, if a child is revealing that they are being abused. So there's all kinds of protocols that the counselors are trained in, but there's no age limit.
Even elderly call in too, yeah.
Whoever, if they decide that they're in crisis and they know about 988, we're making sure that children in schools know about 988. There are schools now who are moving to, on the back of student IDs, they're putting 988 so students have access to the number, because we don't want anybody to not reach out for help because they think there's a rule that says that they can't reach out for help. The counselors are trained to figure out what to do in all of those eventualities and how to get the person connected to whatever help and care that they need. So any questions about how 988 works? Because when you're out there promoting 988, somebody might ask you. So I need to make sure you can tell them what happens. You call, you can press 1, 2, or 3, or you can just press 0 if you just want to get connected right away, and then you can work with the counselor who can help you to resolve your crisis and get connected if you need to other resources in the community. So that's how it works. 988lifeline.org, that is the website that you can go to. It has lots of good information on mental health, substance use, but it also is the place where you can initiate a chat with a 988 counselor. So you share that as well. 988, you can call or text, but if you want to chat, you go to 988lifeline.org on your computer or your phone too. You can chat from your phone also if you have internet on your phone. So we made it as easy as we could for people to get connected.
Outside of putting a claim number 980.
988 on it, wouldn't that be great? You know how over the football game, that plane flies by? One day we're gonna have a 988 banner one day that flies across the stadium.
I'm looking forward to that.
Yeah, I'm looking forward to it as well.
I'm glad you got your 988.
Yes. And so 988 has been operational for 2 years. And in those 2 years, anybody want to take a stab at how many contacts we've had in 2 years?
Since when?
We started 2 years ago. This July was the second anniversary of 988. How many contacts do you think we've had in 2 years? Over 1 million.
Wow.
Anybody else have a guess? In the 2 years that 988 has been operational, we have had 10 million. 10 million contacts. And so that's a lot of people getting help. But we've done some research that says that I think only a little over 50% of people know what 988 is when asked in the community. So if you think that everybody doesn't know about it yet, but still 10 million contacts for help. And that banner's gotta fly. So the more people we make aware, the more people who are able to get help.
What's
And
the
that
percentage of that
were you, I didn't put that data in this presentation, but we have some data around that I could get you to let you know.
Yeah.
And among Black youth, for the first time in history, during the pandemic, the rate of suicide among any age group of African Americans, for youth, it superseded the rate in white youth. And the African American community, we've never, had a higher suicide rate than any other, or than white individuals. But during the pandemic, suicide among Black youth soared.
What
And
about
so
now? What about now?
it's coming down just a little bit. I saw some data last week that said it's coming down a little bit, but we have a special Black youth suicide initiative through the Center for Mental Health Services focused on that because that was alarming. That was a historical, thing to have happened. And so we've got people who are looking into that, analyzing and helping communities to figure out how you can reach African American
You
youth.
say it's new. You say it's new, and it's never happened.
Well,
Our community.
in general, statistics
Our community, we mask a lot. We are not forthcoming.
and statistics around suicide, some, there's probably some underreporting, where there are, say coroners that don't necessarily classify a death as a suicide death, but it was so. But the data that we have is still alarming enough to know that there's still much more work that we all need to do to increase this awareness. You had a question?
I hear you talking about youth. What about seniors?
Older adults?
Because I work with the senior ministry.
So I have a person on my team, and her portfolio is older adults, and we're developing right now a series of training webinars to help providers in the community to understand the unique things that older adults bring to the table when they present for crisis or present for care. One's like polypharmacy. Like the older you get, sometimes you have a whole lot of medications that you take, and sometimes those medication interactions can cause, issues. And so that's something that we're going to be addressing. The developmental things about being an older adult. When you get to be retirement age, or say my dad's age, there's certain things you say, been there, done that, don't even want to talk about that anymore. And so to put an older adult, in a milieu group with a lot of people who are younger, maybe the older adult is not going to be able to relate so much, or maybe the people in the group would elevate that person on a pedestal because they're older, and then that would kind of place them out of somebody feeling comfortable to give them some support or ask them some challenging questions. And so we're working to develop a webinar training series that addresses those issues around working with
And would you
older
come and speak to
adults.
some of our groups?
Would I come speak?
Or
Someone
who's trained?
I love to come speak. When I worked at the state, that was my work, portfolio work, and it's actually personally important to me because my dad is an older adult, and love him to death. But I see different changes that happen. And the older you get, the more your friends, are passing on. So older adults are dealing with a lot of grief issues. My dad is about to retire in December, and again, he's 92. He's pastoring a church. He's 92. But giving up, the work that he's doing, which is a life calling for him, that in itself is a process.
It's a challenge.
We only have.
Exactly. But it's losing kind of the identity that you've had your whole life, that you kind of put your time and your energy into that life purpose, and then what do you do when that's gone?
We only have one agency right now that's located in Thomaston, Georgia, that caters to 55 and older. So we need more agencies within the state that does that.
Who have that specialty?
Right now, is there anything from your agency to sort of talk to the states about developing more agencies that deal with 55 and older?
So one of the things that we do at SAMHSA is we have what's called policy academies, and we have state teams to come in, and it's not just one person, it's a team of usually 10 people from state agencies that come in, and we talk to them about how to design their systems. We talk to them about equity, and specialized services for older adults or kids would be a part of that discussion, that it needs to be accessible for everybody. Just because the service is available doesn't mean that it's necessarily accessible. Because access means, yes, I can get admitted or accepted into the program, but the information that's being provided, the support that's being provided, has to reach me and my unique needs. So we do address that with states in the policy academies. We're working now, it'll be published soon, we're working on an updated version of our national guidelines for crisis care toolkit. And in that toolkit, there's a section that talks about the needs of older adults, and that is, how we encourage states that this is something that you have to prioritize as you develop and design your systems and your facilities, and you make your funding decisions. So it's something that we definitely provide some support and guidance for states. All right, so we talked about the 10 million contacts. We didn't talk about video phone services that are available for individuals who are deaf or hard of hearing, who American Sign Language is their preferred way to communicate. They can go to the 988lifeline.org and click the ASL Now button and get connected by video phone to someone who uses American Sign Language to communicate, and then they get their counseling in that language that's more comfortable for them to use. And so that's a really important distinction as well of how we're trying to reach communities that have had barriers in the past. So we just reached another milestone that's very, very important in 988. It's called geo-routing. And before geo-routing was implemented last week, or week before, when you called 988, you were directed by your area code on your phone. And so just here in Atlanta, Atlanta's a city of transplants. Not a lot of people who are here were actually born here. And so a lot of people have their cell phones that they came here from the state that they came in. They have those same area codes. But so they're in Atlanta, in a crisis, and they would call 988, and their call would get routed to the call center in their home state. And a lot of call centers are really great. They're still able to find those resources and connect people, but it's better if you're connected to a call center that's right in the community where you are. So we work with the major phone carriers and with FCC support, and now, as of last week, most people who are with the major 3 carriers, it's 2, one more is about to be activated. Now when you call 988, there's some wonderful technological things that happen, and you are routed to the call center that's closest to where you actually are, which definitely increases the options for connecting you to help that's right near and accessible and convenient to where you are. So we were super excited about that milestone because again, it brings people closer to the help. And the closer you get to the help, the better that is for your outcomes. So we got geo-routing happening. So I bet you're wondering, is 988 really, effective? Does it really work? I know that's a question that a lot of people have. Well, yes, it has been proven to work. Our research has shown that after speaking with a trained 988 Lifeline crisis counselor, most callers are significantly more likely to feel less depressed, less suicidal, less overwhelmed, and more hopeful. And if you have done any reading about suicide, one of the things that a person who's in a suicidal crisis, they will tell you what they didn't have was hope, that things would get any better, that anything would help. And if you can get a person to have a little bit of hope left, then that may be all that they need to reach out for additional help and support. So yes, 988 is working. It's helping people to get to that next step. And most importantly, it's helping to save lives. It's helping to give people that little window to say, if you're saying that there's help out there, I'm willing to try it. So we're super excited that yes, it's worked. Because every vision doesn't actually work, but 988 is actually working. And we're working to gather more data now on the numbers and types of connections that the 988 counselors are able to make in the community, because that will help us to assess, as you said, what more is needed. Where do we need to focus resources so that, again, that system is available for everybody, 24/7, 365. Every person, everywhere has access to someone to call, someone to respond, and a safe place for help. And you are helping us with that. So I want to read you a quote from a person that was part of a focus group that we did on 988. And she said, "It finally felt like someone cared to just listen and to provide help if I wanted it, which was exactly what I needed at a time when life felt like too much to handle on my own. I never felt judged, and our conversation helped me remember I wasn't alone." And so we have lots of testimonials from callers to 988 who had that exact same experience, that they felt more hopeful and they were able to move on to get to the help that need to get back to thrive. We did some other research called formative research because we wanted to know how do we reach people? Where are we missing? Where are the gaps? And so one of the attributes that people felt that resonated with them the most about 988, the things that were most important to them, were that it provides compassionate, judgment-free care. That's important, that judgment piece. Again, we were talking earlier about the stigma. A lot of people don't seek help because they feel like they're going to be judged. And so one of the most important things people said about 988 is that it's a judgment-free zone. The second thing is that it was available 24/7 because a crisis does not have a schedule. A crisis doesn't care, if the staff at the facility went home at 5 o'clock. The crisis is like, well, it's 2 o'clock in the morning and here I am. So people felt it was really important that 988 is available 24/7. Next, that it offers mental health support, because a lot of crises are focused or centered around mental health needs. It was important that the counselors are trained. We don't want just everybody answering the phones, because everybody, unless you're trained to do that, we don't want to do any harm to anybody. So people felt it's important to know that when I call, there's a trained person who's going to answer. It's not just, we just said, anybody want to volunteer to do it? Love the initiative, love wanting to get involved, but then that training, you have to be committed to that training as well. Can you think about if you needed, I had my gallbladder removed, some years ago. I didn't want to volunteer, doc, to remove my gallbladder. I want a doc who was trained. I love the willingness. I'm glad you were willing to make that sacrifice. But I want to train. I don't want somebody that just said, I saw that on Grey's Anatomy and I think I can do it. We gotta have the training because we want to give callers the best. They deserve that. So it's important that they're trained counselors on the other end of the line. It's important to people that there's privacy protection. You actually can make an anonymous call to 988. You don't have to tell them your name, where you are, or any of those things. You can get help because a lot of people who call, one of their concerns is, I don't want people to know it was me calling. We don't use caller ID. Yeah.
We don't have to call.
We don't have, and if we had, like, the calls are routed by the geo routing, but the counselor has no access to know where you are. And so if there's a situation where a person is in imminent risk of suicide, that's when we connect, 988 connects to 911, and 911 of course has the capabilities to do that, but the 988 counselors don't do that. So you can call completely anonymous and get the help that you need. And then of course, if a connection is needed to a community service, then they would work with the person on the phone and get their consent to get additional information to help them to get connected to the additional services that they need. But everything, is HIPAA protected, so the privacy is maintained when you call 988. And then the last thing that people thought was important is that it's free. Their cost is not a barrier for people who are in crisis. You can call 988 any time of the day, and it doesn't cost you a dime. It's a free service that's supported all across our nation, and states fund it in different ways. Of course, there's federal input into the funding, but many states, if you look at your cell phone bill, you'll see like different taxes on there, and on most plans you'll see there's a tax for 911. That's how we pay a lot of the funding for 911, and a lot of states have initiated that very same mechanism for funding 988 as well, because they bought into the fact that this is a service that everybody deserves to have available, but those things aren't free. You have to have exactly, and that penny helps to save lives. It's something that we all can work together and contribute to, kind of as a collective, as kind of the collective of humanity in our country can contribute in positive ways, financial ways with that penny. Exactly, but it comes back to what do we need to do to save lives and help people to thrive. So it's free. So remember that when you're going back and you're being an ambassador for 988. I tell people it's
I
free.
think we really need to educate from the school level.
Yes.
I have young grandkids, and since the quarantine is out that year and seeing the behavioral changes and the anxieties, that my children, oh, they'll be all right, they'll get over it. It's more to it. So if we don't pay attention to it earlier,
And the earlier, like we were talking about before, that prevention, the earlier we help children to gain these skills, the better they will be.
the parents can use 988 and say, well, my child will come down the hall.
Exactly. And again, we'll reiterate that point that it doesn't just have, it's not only limited to the individuals. Anybody that you care about, you can call 988 to get support for you in supporting them. Yes. Okay, so what are the three components? Someone to call, someone to respond, and what's the respond component? That's the mobile crisis, the units that can go out to where the individual is, and most mobile crisis teams are made up of a behavioral health professional and a peer, but there are lots of different versions of mobile crisis. Some are a behavioral health professional and a specially trained law enforcement officer can do a co-response. But there's also teams that are led by EMTs and a counselor, so there's several different configurations, but the common thread is that they respond. They actually go to the place where the assessment is needed. You know, I can't imagine that there's not a mobile crisis team somewhere that has chaplains, but that is a good, I'm gonna go back and I'm gonna do some research to find that out, because it is definitely an extension of the workforce that makes perfect sense, because chaplains have that kind of training would probably be a great benefit to a mobile crisis team, not only for the people that they're helping, but also for the helpers on the mobile crisis team, to have somebody who's there to ground them and give them some support as well. So I'm gonna write that down. I'm gonna go back and look into that some more. If there are teams across the country that have chaplains as a part of them, because maybe as we're working on some of our faith-based initiatives, that can be something that we might recommend. Wonderful. All right, so we've got someone to call, someone to respond, and then we've got the Safe Place for Help, which are the crisis stabilization units. And Georgia is actually one of the states in the country that has a great crisis continuum where, and you know how sometimes a good thing comes out of a bad thing? Some years ago, Georgia was sued by some individuals who didn't have good outcomes in using the mental health system that was available at the time, and with the psychiatric hospitals, and there were some deaths, and so the state was sued and eventually came under a consent decree through the Department of Justice. And so that gave the state incentive to put together a well-oiled community behavioral health system. And so Georgia has all three pieces. Not only does the Georgia call center, there's one 988 call center in Georgia, and that from that call center, mobile crisis is also dispatched. So those two services are co-located within one agency. And a lot of states don't have that co-location. The 988 counselors have to reach out to another agency to get the dispatch of mobile crisis. But here in Georgia, that happens in one agency. And the state of Georgia also funds the crisis stabilization units that are available to all citizens in all 159 counties of Georgia. People have access to crisis stabilization facilities that are relatively close to home. And mobile crisis can get people immediately to either the state hospitals or the crisis stabilization units, but the state sets the standards.
so how many mobile crisis rooms do we have in
Georgia has two agencies that run mobile crisis. The Department of Behavioral Health is divided into 6 regions, and one mobile crisis team, if I'm remembering correctly, I think one has
Region
4, and maybe the other has 2, but they're divided up among 2 different agencies.
So we don't have.
And there's mobile crisis teams located across the state, and the standard is that they are supposed to respond within an hour, and maybe the time might be a little longer in the more rural or remote parts of the state, but the standard is that they're responding within an hour, because again, crisis needs a pretty rapid response. But all 159 counties in the state of Georgia have access to mobile crisis, the call center for 988 and the crisis stabilization units. And I think I saw the other day on LinkedIn that they just broke ground on another crisis facility, I believe in Region 2, around the Augusta area. So Georgia is in a really unique position that lawsuit actually kind of facilitated the state developing this really great crisis continuum. Yes, ma'am.
And a lot of the incentive to get more crisis centers built and established based upon that $1.7 billion grant that SAMHSA just got.
Depends on which grant you're talking about. There's appropriations for 988, but there are also appropriations that go toward helping states develop mobile crisis teams, and there are the community block grants. All states get that. It's a formula grant. It's determined by the population of the state, but a lot of states use their block grant dollars to support their crisis stabilization units, technology for their mobile crisis. So there's a lot of money that comes to states from the federal level to support development of this crisis system, but states are putting their own appropriations in as well to support the citizens who live there.
I'm happy that you all is coming up and doing things. When they closed all the mental health institutions, it was a dumping ground on certain organizations. I was working in mental health, I was a mental health case manager. So I went out and spent hours with clients, and they called me in the evening, which I'm not supposed to respond, and I got response from those institutions, those people that would come out to be, what do you call response teams?
The mobile.
And they were
that's great.
awesome. They were, especially schizophrenics. Once I said he's schizophrenic, they were on it because they get lost in the system and they're not helped. If they're not seen to in about 2 hours, it becomes more of a crisis. So, and I know at that time they didn't have enough. Decatur only had 1.
Wow.
And yet we had 6 mental health agencies. Only 1. So hopefully now we'll find we need more response.
Yes.
We got fire trucks. Got police cruisers. They got new cruisers in Fulton County.
Yes. And it's great that, the legislature is recognizing that we need to put, more money into communities to meet these needs. So yes, there has been an influx of funding, and we're excited about that because it goes to help the people who really need it. And then that last piece, the follow-up care that makes sure that people move seamlessly through all of those possibilities for transition and that people don't fall through the cracks. And wouldn't you love it, and sometimes I do, like I bought a new car not too long ago, and I had to take it in for the first service. And do you know, they called me afterwards, how was your experience? Did you need anything in the waiting room? I'm like, in the waiting room? I was like, well, I did use the internet while I was there to do some work. So they called, they followed up to make sure that I got what I needed. And if there was they asked me, were there any suggestions that I could give for them to make my experience better? And if we do that for people with cars, wouldn't we do that with people, that we're helping to thrive in life? It's important that we follow up to let people know, we remembered that you were on that journey to care. We just want to make sure that things are working like you wanted them to. And, is there anything in your experience that we could have done better that, we can use that feedback to make the service better for the next person that calls as well. So that follow-up piece is key. I had a map that I was gonna show you all, that showed what states had what services, but again, I can send you the presentation and you can see, but most states have all three components: the someone to call, someone to respond, and a safe place for help. And some states are still working to develop those systems, and some states are doing some really, really creative things. I think we did a site visit, I believe it was in Oklahoma, that there's a place in Oklahoma where people live down in a valley that you can't get to by car. So guess how their mobile crisis teams get to those people in need in the valley? Donkeys, yes. And I was like, that is an incredible way to solve a challenge and to overcome a barrier that you can't get down there by car. So they use donkeys, but they were determined that we're gonna provide this service. And I just thought that was just a wonderfully creative way of meeting and overcoming that barrier. So we talked about Georgia. Embedding equity, I talked a little bit about that, but it's really important that when people present for help, anybody in here remember the show Cheers? Sometimes you want to go where everybody knows your name. When you're in that very vulnerable state, sometimes it's important for people to see people that look like them, who you think they'll know what I'm going through, or maybe they've experienced something similar to what I have, or maybe they understand some cultural things that are important to me. So we work really hard at SAMHSA in the 988 office and in other offices at SAMHSA to help systems to embed equity and to understand that, when you're baking a cake, equity is something you have to put in the mix. Equity is not frosting that you put on the top of the cake. You gotta bake it in, again, because you have to consider people's needs, otherwise you can't prepare for them. And so it's the suggestion that, when looking at the workforce, that you be very intentional about your staff mirroring what your community looks like. And if there are barriers and challenges there's kind of a workforce shortage all across the country, especially in the behavioral health field. And so a lot of states that I've talked to have talked about the challenges in finding clinicians of color or peers of color to hire on their staff. And so kind of the conversation we're having is in Oklahoma, again, we went to a tribal facility, a tribal clinic, and they talked to us about how they kind of raise up their own professional staff. They start with students as interns, and they talk to them about careers and the importance of kind of serving your community, the people who are culturally like you. And so they kind of train them from internship status. They help pay for them to go to school, to complete their master's degrees. They provide, all of the training that they need, and then they're much more willing to stay and help their own community, because it stops feeling like a job and it feels more like a family, something that you're doing for your culture. Like, we've got an HBCU initiative that we're launching in October, where part of the goal of that is to help African American students to see the behavioral health field as an option, a career option for them, and to get them connected to programs where they can receive scholarships and loan forgiveness, to kind of engage them in thinking about, yes, this is something I want to do. And the title of that initiative is called Call for the Culture, and it's helping African American and students of color to see that, when you look back at what people sacrifice for you to have the things that you have today, to be in the place where we can thrive, that we owe it to our ancestors and to those who will come after us to help our community, to help our culture to thrive. And so helping people become aware of 988 and that life-saving resource that's there, but also being the face that people see when they come through the door. Being a psychiatrist of color who can be there for, a patient of color who already is coming in the door not trusting the healthcare system because of, past traumatic things that have happened in the African American community with the healthcare system. So when you come in the door, seeing a doc that looks like you may be just that little thing that a person needs to say, okay, I can trust. I can let these people help me. So that equity piece is super important, yes.
I agree with that African piece, but beyond that, it's the rate of pay.
Is what?
The rate of pay.
Yes.
Because if that is not at a point whereby you can stabilize your family, then you're not stabilizing the intervention.
Absolutely. That's one of the other things that as a federal government, we are able to talk to states, we're able to talk to institutions of higher learning, and so we're able to give some guidance and to highlight the issue to say that, yes, if you can't support your family on the salary, I could go drive for DoorDash and have less stress, and I can at least make, this amount that you're paying me, and if I really want to hustle, I could make a little bit more. I was in an Uber one time, the driver told me he paid 6 figures driving Uber, and that's all he did to make a living. So yes, that is important because I'm in school right now. One of my professor's taglines when we're talking about economics is, as a provider, you got to keep your lights on. And so yes, it is critical that the rates of pay, are adjusted so that facilities can thrive, and so that the staff that work there can thrive as well. And part of our work on our crisis service definitions and standards will help payer sources to understand this crisis system better and what the needs of patients are. And I just have every hope that that is going to happen. But if you look at, most movements in our country, things don't happen overnight. They happen slow, but they happen when people are giving them continuous, deliberate attention. And I just feel like there's so many powers that be at SAMHSA who are working, who understand how important that is, and are working to do all that we can to help make changes there. All right. So we're getting down to the end. We've talked about equity, we talked about faith-based. So the only thing that we didn't talk about yet are some ways that you can get more information for yourself to arm you as you're an ambassador. You got to have some tools in your pocket, right? So there are websites that you can go to and you can order free materials. We got refrigerator magnets, we've got postcards, we got posters, pamphlets, all kinds of things that you can order in bulk for free. Some you can get 50, some you can get 100, but you're not limited in how many times you can come back and order. But materials that we will just send you in the mail for free to use. And so when I send you this PowerPoint, it will have in there the website that you can go to the SAMHSA store and order some of these materials for you to use as you spread the word. So it's called the Partner Toolkit. If you work in an agency and your agency wants to begin to promote 988, we have social media things in there that you can use. We give you all the tools that, as helpful as you want to be, we have given you the tools to be able to do that, to create your own marketing materials. And you can put your own brand on there as well. So that it has your agency brand on it as well. We just want you to get the word out to people. So I'll send you that link to the Partner Toolkit where you can, you can download things, and then to the store where you can order things free of charge. And then when you get it,
I still have three reminders for your handbooks.
with SAMHSA materials, I have a shelf full of those as well from when I was working with the state. I got those tips, they call them. I have tons of those.
Mental health assessment.
Yes. We try to be helpful at SAMHSA. We really do. We're always thinking about what will be helpful to the field, what materials would be useful for people, and we're always trying to develop those and publish those. And then the last thing, you can sign up for our partner newsletter, and that way you can stay abreast of how things are developing on all of the fronts. We try to have a balance of things that we report on. We also have a training and technical assistance center that puts out a monthly newsletter as well. So you'll be able to access all of those sites when you get the PowerPoint. And so, how many people, this is a B or C choice. How many people in your life are you going to share 988 with? A is one person, B, my family and friends, C, everyone I meet. C. That's the answer that I wanted to hear. so that's the end of exactly. So you're gonna tell 988 to everybody that you meet, and I really do that. Like I travel a lot for work, so I take a lot of Uber rides. So every Uber driver that I'm in their car, when I get out, they're gonna know about 988. If I have like T-shirts that I wear to the grocery store that say 988 on the front, and I've got one I just ordered. It hasn't come yet. It says to the person behind me, "You matter." And so I wear that just so people can say, "What's that T-shirt about?" And then they just open the door for me to tell them about 988. But it's important that we let people know that this is available. And so I appreciate you all's willingness to want to help us with that. Yes.
I think it's good because now there's so much depression, as you just mentioned, and anxiety. We need to tell people about 988.
Mm-hmm. And you know, there's this phrase, check on your strong friends. You know, that you all have friends who always look like they have it all together. But is that really real, you think? That they always have it all together? Yeah, so check on your strong friends, because they need to know about 988 as well. Not just the people that you look at and you say, oh, I can tell they in a crisis, or they just got out of a crisis, or they're about to go into a crisis. But check on your strong friends that look like they have it all together, because we all have times when we need support and we need help. And this is a great tool for people to be able to access.
Service, if you don't see a member,
Check on them.
just call.
So, yes, tell the hospice team. Yes. Because, and that is a very high stress occupation. There's certain occupations that have a higher risk of suicide. So definitely tell the team at the hospice facility about 988. We got magnets they can stick on the refrigerator in the break room. We got stickers they can take home with them. Go to the SAMHSA store and order some things.
So 988 now
It's
it's across the country.
across the country, available in all 50 states, all territories, all tribal nations. Everybody can pick up the phone wherever you are and dial 988. So that's the end of my presentation, but I will take questions if anybody has any questions remaining.
Question that I have for you is that 988 coming into Georgia. Has there been any effort to get to the family connections to ensure that they can be disseminated through the 156, 155, 157 of the 159 counties that we operate?
Say more about it. Family Connections, the agency?
Family Connections is an agency that functions in all 157 of the 159. There is a central agency that disseminates information to those. Has anything been done to get to that one, or you just go to DBHDD?
So that was where I was gonna go. DBHDD is the entity in Georgia, that's the state mental health authority, and they are, 988 is under the Department of Behavioral Health. So any of the information that goes out to the other state agencies and then flowing through those state agencies to the organizations that they fund and manage, I know that they're doing everything that they can
That's the reason why
to get that information out.
And that would be duplication of effort. That is out.
Yeah, but if you check like the DBHCD social media, they're out every day. They're talking about 988 and trying to get the word out. So, and that family connections piece is really important because what we know about youth in crisis is that you can't really treat a youth in crisis without their support system being involved as well. So families are really, really important. So I can't tell you with certainty what they're doing, but I do know the folks over there, and I can tell you with certainty that they're working. Find out what they're doing. All right. Well, thank you so much for listening to me today and having this dialogue. And you're 988 ambassadors now. You're sworn in. You got to spread the word and let everybody know. All right.
Thank you so much for coming, Ms. Mays. God bless. All right, so what we're gonna do now is take about a 15-minute break, and hopefully, Reverend Hulon will be here by that time. If not, it's gonna be called the day. Thank you.